As we continue off with the conversation, self-medication is very common, pardon me, especially for minor health issues. While it can be convenient, it is important to understand the potential risks and how to use it safely. Today, we're joined in studio by Frieda Shigwedha, who will be discussing the benefits, the dangers, and the role pharmacists play in helping people make safe choices when it comes to self-medication. Now, Frieda Shigwedha is a medicines information and safety pharmacist. Good morning, Frieda.
Good morning, Dapira. How are you?
Good. How are you?
Good, thank you.
Thank you so much for making time to talk to us.
Thank you so much. Thank you so much. I woke up a little bit under the weather, so I'm probably going to have to self-medicate after this.
Oh, wow. Okay, now speaking of self-medication,
Yeah.
how would you describe it, and what are some of the most common ways that people can actually practice it safely?
Okay. So self-medication is essentially defined in itself. It's being able to get a medication when you walk into a pharmacy, what we call over the counter, right? OTC, and you're able to get that to treat a minor ailment that you have. So this can be like a paracetamol or Panado for a basic or a mild headache, or it can be another product as well for, or let's say, for example, Gaviscon for like heartburn or whatsoever. So it's basically you also doing it based off of what you've experienced before, and if you received certain treatment before that was over the counter that you're familiar with and you knew that it worked, then that's what you're going to use. Yeah.
What are some of the benefits of self-medication?
So number one, it's convenient, right? Because I
Very.
mean, you just get to walk into a pharmacy, ask for what you want.
I don't need
or
a doctor's
You don't need a
letter.
doctor's letter. You don't
Yeah.
need to pay a consultation fee, right? So it's also cost saving. And then also, I think as healthcare workers and even as the general public, when you do that, you have a level of empowerment, right, to make
Yeah.
a specific decision about the kind of medicines that you can take for your ailments and so forth. So having that little bit of information really helps. So I think from that perspective, yes.
Amazing. As much as we have advantages to it, there's definitely disadvantages. What are some of the disadvantages or perhaps the dangers that people should be aware of
Yeah.
when self-medicating?
So when self-medicating, you are using the layman's knowledge that you have, right, to treat yourself. However, you could also possibly misdiagnose yourself. You know, you could be having similar symptoms, but then it's not the exact disease that you had before. So then, of course, if you misdiagnose yourself, there's a possibility that you're going to get the wrong self-medication. Because if you're interacting with your pharmacist and you tell them, no, I think I've got a mild headache, then they might just give you something that's really mild, but then it's actually probably a migraine that's developing, you understand? So there's misdiagnosing yourself. Then there's also the possibility of overdosing medications, especially if you don't want to go to the doctor and you know your ailment or whatever you're suffering from is continuously reappearing and reoccurring, and you take medication just for short-term relief, but it's not really doing the job that it's supposed to do, and meanwhile something much more severe could be developing. And then also with certain products on the market, especially if they are, let's say, codeine containing products, there is some codependency that could actually occur, which can also lead to abuse of these as well. So we get to see some of these circumstances within the pharmacy. So those are really the risks and dangers. And you know how you go to a pharmacy or to your doctor rather, and they prescribe you flu medications, and then you get to the pharmacy, then you're like, oh, where's the antibiotic? Then there's no antibiotic, right?
Yeah.
And then we've got an issue of antimicrobial resistance, whereby the antibiotics that we use these days can no longer fight the bacteria that is in our body. So resistance from basic medication like self-medication is also something that can occur.
Right.
Yeah.
Now, someone that likes self-medicating.
You.
Yes. What are some of the appropriate medicine that one can perhaps get, apart from immune boosters, of course?
Yeah.
Yeah.
So you can also get any other supplements and vitamins. So with self-medication, or what we call over-the-counter medicines, they are classified either as Schedule 0, Schedule 1, according to our regulations. So this is basically them posing a low risk and not really needing a doctor's prescription or having to pay a consultation fee, and you basically basically just get it based off of the pharmacist's engagement with you.
Right.
So that's how you can gauge it. So those are the kind of medicines that you can get, and even like over-the-counter creams, for basic allergy rash that you have, or a fungal infection that is appearing topically, etc. So yeah, you do actually have quite a number of options.
All right.
Yes,
As long
yes.
as it falls part of Schedule 0,
0
and
and
1.
1.
How many
Yes.
schedules are there?
There are actually 6 schedules. So from
Okay.
Schedule 0 to Schedule 6. So from Schedule 2, you would require a prescription.
Okay.
Yeah, any medicine that's classified like that, yeah.
So those ones are the high-risk ones?
Those are the high-risk ones, yes.
All right.
Yeah.
Now, obviously, pharmacists over the counter, how can they better educate their customers as well as the patients that are coming in about the different medicine that they perhaps want for self-medication?
You said it. How can they educate? They should educate.
They should,
They
right?
should, right? You should inform your patients exactly what to do and what medications they can. But before you can inform them, you have to ask them the right questions, because you need to draw the information that you need in order for you to ensure that you actually give the right intervention and treat them appropriately, and that the treatment that you're giving is optimal. Because if you also ask the wrong questions, or you don't probe enough, then you will not get the right answers. And a lot of the times you'll see that the medications that patients come to get in the pharmacy, some of the relevant questions you should ask are like, okay, when did your headache start? Have you taken anything else for your headache at home? If yes, what was that? Right? So that you also don't duplicate the treatment that's probably already at home.
Or overdose the patient.
Overdose the patient, yeah. And you also need to be very cognizant of the fact that the patient could potentially be on other medicines for a chronic or acute ailment. There could be drug interactions, right? If they're taking something at home and you don't ask, are you taking anything else? You could be giving another product that could potentially interact with that. And there can also be like contraindications or certain warnings. And then what you also find very commonly is like taking certain herbs or supplements, which we think are really harmful, but once they come into contact with certain medications, then it could be a problem, especially if you're not aware. And even with interactions with food, some medicines you shouldn't be taking with milk, right? And you're taking it with milk. Some medicines you're not supposed to be taking with grapefruit juice, and you're actually taking it. So in order for us to really empower our patients, we need to ask the right questions for us to be able to treat them better. Yeah.
All right. Are there rules in Namibia about selling over-the-counter medicine, and also how do these rules affect self-medication?
So yes, there are certain rules in place, so self-medication is generally much more available on the open floor. Like if you step into the pharmacy, you don't necessarily need to get to the dispensary where the pharmacist is. But the regulations and the limitations for how we classify medications, those are the protective mechanisms that we put in place to ensure that certain medicines are not abused, and certain medicines can only then be given to patients after certain laboratory tests have been conducted, or further medical, examination by the prescriber or the clinicians, because it's important, right? And I think this is information that we see from clinical trials that have taken place in the past. So it's important to be cognizant of that, and then use that information also to empower the patients. And as a pharmacist, you cannot be very nonchalant in the work that you do. You get smart patients, Ndapewa. You get smart patients who are very inquisitive about their health, who go the extra mile to read what the medication is about, what the active ingredients are in, how each one acts, etc., etc. So you also kind of have to be on top of your game, because everybody uses Dr. Google these days. But how are you going to be better than Dr. Google? Like, what advice are you going to give that could be potentially life-saving to this person?
Exactly.
Yeah.
So we should stop being our own doctors, no?
Yeah, stop. Like, you can be inquisitive, but just ask a healthcare professional to make sure that you're on the right track, because we don't want you running back again and then we'll say, you should have asked us.
I hear you. But what are some of the what do you call this? What is something that people should know, especially those that love to go for self-medication? What exactly is it that they should know before they basically just go and get perhaps self-medication?
Yeah. So one of the things that they should know before getting the self-medication is that you also hold the power of life and death in your hands, right? You are equally responsible for your health. So before you just take anything recklessly, also try to determine if you're really having that ailment. If you don't feel so confident, go the extra mile, see a clinician, see a prescriber who will be able to then help you sufficiently and really diagnose you appropriately. If you don't do that, then I mean it's really not going to work. And we also know that in some areas where we have, you know, Namibia as a country geographically, we're very wide, and there are some areas that just do not have access to healthcare services. If you're going to get access to that in order for you to have self-medication, then you need to be doing it in the right way.
All right.
Yeah.
Frieda, thank you so much for
Thank you
joining
so
us this
much.
morning,
Thank
for
you so much,
educating us,
Deborah.
for helping us understand self-medication.
Yes.
And I'm sure for all the viewers this morning, we will make sure, before we get those self-medications, we will make sure to visit at least our doctors and
Please
just
do.
ask for the right advice, if
Yeah.
not the pharmacists over the counter.
Yeah, save money, go into a pharmacist, right?
Yeah.
I'm not saying don't go to a doctor, but you know.
Well, thank you so much for
Thank you
joining
so
us.
much. Thank you so much.
All right.